And let me just begin by introducing the distinguished panel. But before I do, let me tell you how excited I am to have four of the people that are driving change in the Boston area and medical institutions to not just address climate change and not just to look at their own operations, but to recognize that climate change is really about how they can be part of their own community, how they can serve the broader community as well as serve the people, their patients, and their workers by looking at all of these issues together. To me, it's very exciting for a couple of reasons. One is that I've always considered climate change to be the biggest public health challenge that we face today. And I also think that it's a tremendous opportunity for us to look at how these issues align and work with one another and how we can work together to address the issue of climate change in ways that improve health right away. I think the biggest challenge we face is when we say climate change, everybody thinks about the planet and not themselves and not their own families and not their own communities. And we have four people here who have broken through that in their own institutions. And I'll tell you, I'm not unfamiliar with institutions. I know that it's very easy to change them. So I don't know why we need this panel at all. But I think we all know that, frankly, institutions are incredibly difficult to change. People are difficult to change. And in an area where the climate is changing and our health challenges are getting more significant, you know, we need to figure out how we work together. And for some reason, these four have been able to do it. So I'd like to introduce them and then talk a little bit with them about the challenges they've faced, why were they motivated to take these actions, what were the most fun things that happened, what were the most difficult, and what comes next. Okay, sound like a plan? Perfect. All right, well, it is perfect. Nick, I want to start with you, is Dr. Nicholas Hill. He's the Chief Pulmonary Critical Care and Sleep Division at Tufts University School of Medicine. He has been a past president of the American Thoracic Society. He has bothered me all the way at EPA about issues that we weren't able to deal with or should deal with. So I know him, and he's been a great activist for many years on these issues. We've got, ooh, sorry, I dropped my thing. Bernard, can I call you Bernie? Bernie Jones, who is the Vice President Public Policy at Brigham and Women's Hospital. He's a terrific advocate at Brigham's. We have worked a little bit together, but he's not only looking at how he leads Brigham and Women's on sustainability issues, but he's worked at universities trying to do the same thing, which many of us at Harvard have been working towards as well. I want to also recognize Dr. Patrice Nicholas, I should say, who is the Distinguished Teaching Professor and Director of the Center for Climate Health, Climate Change, Climate Justice, and Health at MGH Institute of Health Professionals, which I helped launch. Pulling into the wrong parking space to get there, but it was good. I always mess up when I'm going places. But Patrice has been a terrific advocate. She's authored and co-authored over 100 peer-reviewed manuscripts talking about climate change, climate justice, and climate health-related consequences. And last but certainly not least is Kathleen Walsh, which if you live in and around the city of Boston and don't know her, then you've missed something. I will tell you, she is the president and CEO of Boston Medical Center. She is actually just a force to be reckoned with. She's worked at Brigham and Women's Hospital as the chief operating officer. She was the chief operating officer at Novartis. She was at Mass General Hospital. She was at the New England Cities Hospital. She's on the board of the Boston Public Health Commission. She is the most successful woman who couldn't keep a job that anyone of us knows. So I am really excited to have them here, and I want to, just start with a little question that each of you can tackle. And Nick, if you wouldn't mind starting us off, why are you engaged in these issues? What's the motivation to start looking at change in your institute, and how did you communicate your motivation to others to get them excited about it?
That's not as simple as some questions could be, but
Okay, what's
well,
your
let me-
middle name? Would that help? Start off with something like that?
But anyway,
You're in the medical profession and you do research. What's simple about any of that?
but let me talk about some of my inspirations. One is that I have a daughter who is an environmental militant, and when I told her I was going to be on this panel, she said, "Dad, you must do this." And she's been telling me for some time that doctors aren't as involved in this issue as they should be. And although we have quite a number of physicians in this audience who clearly are very involved and very passionate, the fact of the matter is that as a community, physicians, I don't think, have gotten the message out very clearly to the greater public. You know, there are obviously too many people who want to believe that climate change is still a hoax. And I think, and my daughter said this, that we need to turn up the volume. We need to do more education, not only of our peers, but of the public, and really try to get out there and show our passion about this. Another inspiration is a young gentleman sitting in the audience, Alex Rabin, who actually nominated me to sit up here. But Alex worked with Mary Rice at Beth Israel Deaconess down the street and is very passionate about this. And I see my role as his division chief as a catalyst. He has a lot of passion, but I have encouraged him to pursue this and take it where he can take it. I think that the time is ripe in this country, in this world, to really try to do something about this. I think ultimately it is a political issue, and we have to convince people who cast votes to vote for people who care about doing something about climate change. Clearly we have a little bit of a problem with that. But I think Gina pointed out the importance of working in communities, educating, collaborating, participating, and being passionate about this issue. Alex and I were talking about our own institution, Tufts, which could do more, and Alex is planning to meet with the CEO in the near future and try to make sure that as the institution goes on with building plans and working on perhaps offsets and so forth, different strategies to try to reduce the carbon load and try to reduce the greenhouse gas effects and so forth. I think that this is a very important part of being in a medical community, because we know that we are contributing an enormous amount to the greenhouse gases. So I'll stop there and let somebody else say something more exciting, but that's where I'm coming from.
Well, I was excited about it.
You're too kind.
Kathleen, you know, Boston Medical Center is probably one of the most active institutions in the city. And part of the reason to start in Boston is we've got just about the best medical care facilities, and to have you at the forefront of looking at how you serve your patients in your community by considering climate and health impacts. I'd love to hear, how did that happen? How'd you start it?
Sure, thanks, Gina. So as our climate journey, our sustainability journey started, as many things start at Boston Medical Center, kind of a combination of, we were frankly looking for budgetary savings and felt that there was an opportunity within our operating budget to reduce our energy spend. We were also increasingly aware of the challenges that we face as a safety net provider, on the fact that our community is less healthy than the communities around it. And if you look at the impact of climate change, and particularly like superstorms or weather events, they disproportionately hurt low-income communities. They're more affected during the event, and it takes longer for them to recover. So we started thinking, what could BMC's role be in God forbid something like that happened? And you know, if Superstorm Sandy had taken a different turn, we would be talking about this in the city of Boston. We have over 5,000 square feet of yards of land that wasn't there. It's landfill, so it could be washed away in a moment. I think the third thing was and what I don't think we completely appreciated was just how empowering it was to our workforce. And so I would say to anyone who's leading an organization is to think about this in terms of how it really helps you with employee engagement. This is the issue of our day. And to see how, what were very nascent efforts really grew into a way BMC thinks about how we serve our community is really just remarkable. So I'll give you two specific examples. One is when we did our campus redesign, sustainability was at the core of our work. And so, for instance, we financed a major campus renovation with green bonds. Now, I don't know what that says about the economic health of the organization I run, that they thought we were a better sustainability bet than we were as a hospital bet, but here you have it. But we were able to we got more debt at a better rate because of our climate commitment. And the second thing we were able to do with that is to create what's called islanding, so that in the event of a major event in Boston, we can basically sustain ourselves as an energy, from an energy standpoint. You go dark and then you go onto this island, this cogeneration facility. And what's great about that is we can also support Boston EMS and the Boston Public Health Commission with that. And so those are two ways that we could do something that was good for our organization and give back to the community that we serve. And I think those examples are out there for all of us to consider.
Kathleen, this is great. I've been telling people that the economic argument is actually a really good one for a change.
It was for us, but again, as I said, it could just be a function of our other economic arguments not being as strong.
Bernie, why don't you tell us what you've been up to?
Sure. So it's impossible to talk about what the Brigham's doing without also talking about what Partners, or the artist formerly known as Partners, now Mass General Brigham, has been doing. So we're very proud of the early and fairly significant commitment that Partners and its institutions have made around the issues of climate change. And we've taken a great example from what Kate and BMC have done, but we as a system have made commitments around carbon neutrality and actually being a net positive institution by 2025, about significant reductions to the order of 30% reductions in our mission usage over our baseline, and also really creative activities like investing in solar and in wind to green up our own energy supply. I've been in the second half of my job, which is heavily focused in these kinds of efforts, for about 6 or 7 months, and I have the advantage or the disadvantage of being the first person ever to have this kind of job at the Brigham, and I like it because no one actually knows that I'm doing at any given time. So I've been able to really harness, speaking of inspiration, harness the energy of our faculty, of our trainees, of our residents, and of our young employees who share this unapologetic ambition for what we can achieve together. And so I'm very proud of our operational commitments. They're really important, but I view them as the minimum price of entry into this dialogue. But what I'm really focused on doing, and I've started a conversation with Kate and with others, interesting places like the Boston Public Library, about how we as large, well-resourced, highly visible civic institutions, how we can advance the discourse on this in highly visible ways that also focus not on just what is the problem, but what are the practical solutions that we can work together to advance collectively. And so only 7 months in, so a lot of work still to do, but really just building a fire around which people can warm themselves on this issue for places like Brigham and Partners.
Is that a climate warming kind of an analogy?
I didn't intend it, but we're working well together here, so yeah.
Patrice, why don't you talk about your center, what you're doing, what it's focused on? It's a little bit different, and I think it's worth a good discussion.
Thank you. So I'm the director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. We are a health professions educational institution, not directly affiliated with a medical school. However, we do have Harvard Medical School students join us in our impact practice curriculum, which is aimed at advancing interprofessional competencies. So with the background of climate change as a risk amplifier, exacerbating inequities, social injustices, inequalities, and vulnerabilities, we built a vision, mission, and developed core values around our center. We were fortunate to have Gina as our inaugural speaker at our symposium last year. To rave reviews, no surprise. And we're delighted to have Renee Salas join us as our keynote speaker this year, and also Dr. Regina LaRock talking about climate advocacy. I'd also like to say that I read recently Renee's interview in the Harvard Gazette about this particular clinical practice symposium and the fact that primarily physicians are in the audience. But I offer kudos to you, Renee, because one of the questions was, are there roles for other healthcare providers? To which she offered an exceedingly positive statement about every health professional who provides direct care needs to be climate educated and focused on bringing that into every patient encounter. So thank you for that, Renee. I'll also add that our Climate Center is developing health professions curricula across the health professions. We also have writing groups to publish literature in the physician assistant literature with nurse practitioners in the Journal for Nurse Practitioners and others, because we have a lot of work to do to educate all of the health professions. We also have a partnership with the Harvard Kent School, and we have Earth Day events, and we're educating teachers and students. And I do urge you to look for a PBS NewsHour document that's called "The Hotter the Planet Grows, the Less Children Are Learning." And it's a very, very impressive study conducted by economists in partnership with the College Board. They engaged 10 million students' scores on the PSAT, which is taken over periods of time. They had 21 million scores to analyze. They were able to conduct climate modeling, so they knew the temperatures in various areas of the US, and they found significantly lower learning as the temperature increased. So for every 1 degree Fahrenheit, there was 1 degree less learning for students. They also discussed the challenges around non-air conditioned schools. So when you think about student learning, wherever students learn, it's particularly important. And because I have a granddaughter in the Boston Public Schools, her first day of school was 95 degrees. And I happened to go and pick her up. And I wrote to our terrific superintendent of schools, Dr. Brenda Casalius, to add to what are likely lots of challenges, but one being climate, when you have a child, as I do, in a 1910 built school that's brick and climate intensive environment during very hot days.
Thank you. Well, let me pop a question out to anybody that here that wants to answer it, and that is that, you know, there are a lot of people out there, I think, that are wondering how they can activate their institutions more. What's the one thing that people demanded or you delivered that you think brought the best energy around this? In other words, how did you get a big leap forward? And what was it?
For us, it was savings. I think the hard thing to recognize is the most efficient square foot is the one you don't build. And most of us run organizations that really thrive on growth. So how do you, and growth is how you attract, you know, great clinicians and how you build great laboratories and how you, you know, it drives the economy, it's how we're all measured. And I think the discipline that it takes around physical space and how you use it. Things like, a bad example, but it's pertinent, there are a lot of young people in this room, hoteling of call rooms, hoteling of on-call rooms. You know, people, you know, services used to have their own call rooms. Maybe they still do in some places. Or do people share lab benches? I mean, just think about how much space we build, you know, in this square mile that is often fallow and not used. And I think that's the hardest thing for people to approach. And I think that's the biggest part of cultural change. Everybody gets it that they want to be able to take a deep breath. But I think it's hard to reconcile your sustainability aspirations with growth.
You know, I think one of the things that is challenging, and I've worked with scientists before and people who are professionals who really thought highly of themselves. Sharing is not generally a part of the discussion. And so, you know, it's really, you're talking about behavior change. So, I mean, and so how did you translate what you just said into getting them to agree to change their behavior?
Well, for us, it was we were closing a building and moving into another campus and renovating that building from the inside out.
Okay.
And so that at every turn, I think Bernie said it, every project we did had sustainability in mind. We got advice from our colleagues at Healthcare Without Harm. We, I see Bill and others in the audience. I think it really is, I think I think you have to approach this with a good deal of humility. And I think Patrice mentioned vision. And what I neglected to say is that BMC has this, we've always had this mission of providing exceptional care without exception, and we're sort of known for that. But we also have what we call Vision 2030, which, by the way, seems a lot closer than it did when we launched it, which was to make Boston the healthiest urban population in the world by 2030. And if you think about health, the climate imperative is top of mind.
That's terrific, Kathleen. Anybody else?
So two things come to mind. The first is enabling your entire employee population, but perhaps particularly your physicians, your clinicians, your frontline providers, in ways that they can contribute to this issue. So we have an emergent group called our Eco Green Team at the Brigham, and it's a group of operational leaders across supply chain facilities, environmental services, research administration, et cetera. But their main job is to first incubate sustainability initiatives at the divisional, departmental, or unit level, but then also to receive inbound suggestions of what are the simple practices that we as an institution can do to be more sustainable, to be more green. And I think everyone is hungry for the small ways that they can contribute, in addition to participating in the big ways that we all need to collectively contribute. And I would say the other thing that really has made a difference, both for climate change and sustainability, but what I would call all the third dimensions of what healthcare institutions do beyond the provision of healthcare, whether it's gun violence, opioids, homelessness, is talking about it from the leadership position out to your institution and letting them know that they aren't the only ones who care about these issues, and that oftentimes bureaucrats like us can seem like we're only focused on margin over mission or the bottom line, but we too really care about these things and we want to support them, and importantly, we need to resource them. So it's giving people opportunities to engage and giving them a sense that we're all pulling in the same direction institutionally.
So Bernie, let me just follow up. What's the structure you have for that conversation?
So to date, it's been principally in town halls or leadership convenings led by our president, Betsy Nabel, who's very committed to this issue, our chief operating officer, Ron Walsh. But one of the things that I've started doing here, and the MGH is doing something similar, is creating a climate action council at the Brigham that is populated in equal parts by leadership who can meaningfully change either operations or practice, but an equal population of faculty and clinician leaders. Because being schooled at the University of California professionally, you can't get anything done unless the faculty are bought in. If it's just a bureaucrat-driven initiative, you're just not going to get things done. But if it is from the ground up, led by your faculty, led by your residents and your trainees and your own employees, you can almost get anything done. And so it's creating an environment where they have an opportunity to influence policy and practice at a senior level, but not just have the same people who are in every meeting together doing that, but bringing in fresh perspectives and different viewpoints on this issue.
Nick?
Well, we are, at least as healthcare practitioners, we are in a caring profession, and most of us are do-gooders, and we want to do the right thing. I don't spend as much time in the C-suite as Kate Walsh does, but I believe that also extends to the C-suite, that people are motivated by ethics and wanting to do what's right for society. So I think they want to listen to people advocating for controlling the carbon production at their facilities. And I guess, Kate, you do offsets at BMC, do you not?
We're like within a hair's breadth of being 100% carbon neutral. We had hoped to be there by the end of this year. We have a wind and solar deal with a large, We're not there yet, but we have a wind and solar deal with a large wind and solar farm in North Carolina, and it sits on, I think, 635 acres. And the whole south end of Boston is only 300 acres. So a lot of the solutions for this are going to come from outside of the city of Boston and from different kinds of partners. And I'd make one other point. Yes, we are well-meaning, but we are energy hogs as an industry. You know, things are on, lights are on, things are beeping 24/7, 365, and not only in the patient areas, but in our laboratories and even our teaching environments. So it's really important that we realize that I think it's 10% of the greenhouse gases are from our sector. So it really is, it's an imperative for us. If we don't get this right, I think a lot of other people would have to do a lot harder work.
Yeah, I've seen figures that the healthcare industry is responsible for about 10% of carbon production in the U.S., which was astounding. I do think other ways of motivating people, I learned this when my lawyer daughter was 2, that if you can give people the idea that they came up with the idea, that helps. And although they do want to do good in the C-suite, they also don't want to run their institutions into the ground. And as you point out, Kate, if you can demonstrate that some of these things will save them money, that also is a much stronger motivator. And I also mentioned tapping into younger people. You know, I sense there's a lot of energy and interest in this issue in our current college population. Well, the Harvard-Yale game was held up at halftime for a couple of hours by a demonstration, but on climate change.
Anybody proud of that?
Yeah.
Damn, I wanted to go.
But people coming up through training now are very motivated in this area. You know, the OK boomer thing is very meaningful to them. So I think you can take a whole variety of strategies, use some psychology. I think, Gina, you mentioned also, or Patrice, I think you mentioned bringing this to our patients. And I wanted to hear some more of your thoughts about that. If I could ask a question, Gina, because
Whatever.
I think. Really?
No. Yes, you can ask a question.
We're working on an integrated curriculum, but unique aspects of curricula, for example, for advanced practice nurses and physician assistants. So, for example, their colleagues of physicians, particularly in emergency department areas, where they are certainly responsible for not only collecting an accurate health history, including a climate-impacted health history, a focused physical exam or a comprehensive exam that addresses potential climate risks, formulating differential diagnoses that might be outside the box, like heat stress or heat stroke, not thinking about an elder with an acute neurological issue, but could it be heat stress leading to heat stroke? And then patient education, which is absolutely critical. So at the MGH Institute, we have students, and I'm sure the same is at Harvard Medical School, that we have engaged students who are so passionate about climate change. Our students conducted a survey, developed a poster for the Institute for Healthcare Improvement National Meeting, which was in Orlando in December, and presented that poster to rave reviews. And they are working with us both on our steering committee for the center with community efforts, with students in the schools, and the elders in the Charlestown community and beyond. And we're really making progress on engaging not only students in health professions education, but climate activism, which is really important.
You know, one of the questions that I wanted to ask next was, you know, every hospital is really part of a larger community. And one of the things I think is of larger value, even beyond the medical care in the institutional setting, is how you can bring climate change out of partisan politics and into normal functioning. And I think adaptation is one way that you can do that, but I wanted to challenge you to do you actually encourage discussions within the broader community? do your physicians, are they encouraged to go out to community meetings? Are you looking at what your community is doing? And how does that factor into the way in which you're envisioning your future?
So I'd say the short answer is not enough. And I think that the challenge of being an academic medical center is you have lots of really smart people who all get together because they really like working with other really smart people and they want to solve hard problems. And I think that isn't always the most welcoming environment for people who are differently educated, think about the world in a different way, have different cultural norms and practices. So I think that that's something that, as healthcare providers, we can be much better. And I'm really happy to hear about Patrice's curriculum, because I think that could be a big part of pediatric practices of the future, and how we, or adult practices of the future, how we think about climate in day-to-day life. You can't deny the facts, although some people choose to. The other thing, the C-suite comment Nick said earlier, I think my job as a leader is to really get out of the way. I had no idea until I heard the BUR story about that we changed anesthetizing agents in our operating room, that one had a bigger carbon footprint than the other, and I can't even pronounce them. But somebody said we should use this agent instead of that one, and we got out of the way. Like, that was the right thing to do. I don't know if you heard the story, but we just, one cane has less than the other.
I know the issue.
Yeah. And I think that, so for those of you who don't hang out with hospital CEOs all the time, and you are a blessed bunch.
There'll be a reception at the end of this.
I seriously would say, if you have a good idea, you'd be hard pressed to find a CEO who doesn't want to try it, because for every dollar, the amount of revenue we have to generate for every dollar that we save is almost a 3-to-1 ratio. And so if you, because of overhead and the crazy way healthcare gets reimbursed in this country, so if you think about, if you can find a way to save costs, I think the green team idea, whatever it absolutely makes sense. I mean, at BMC, we looked a long time for somebody to recycle the blue wrap in the OR. And nobody would take it. There was no market for it. We're going to turn it into tote bags so we don't give out plastic bags in our food bank. It's a good idea. It's not a great idea. Spend more energy, but I didn't come up with that idea, And so, 99.9 times my job is just getting out of the way, and then sometimes it's finding some funding for a good idea.
Kathleen, do you have full-time people working on this? I mean, how do those ideas get generated and move through the system?
Our SVP for facilities is a guy named Bob Biggio, and he's just brilliant. So he's the guy who came up with the wind farm thing. But the tote bag was somebody in environmental services. If you went to Boston Medical Center and said, I want to take a tour, someone would take you to our biodigester, where we compost 400 pounds of food a day.
You are a fun bunch.
Yeah, we really are. But seriously, when the Joint Commission came through, in their closing thing, they talked about our biodigester. It's good. They missed all the other stuff we didn't do right. But I mean, no, we were perfect.
Don't include that in the minutes.
Don't use the word perfect.
Yeah, but I think it's, that's true, yeah. It was but anyway, I think that people are, it really engages folks. And I think the step we need to take as a healthcare industry is figuring out how to engage our patients better.
And Gina, just to return to the beginning of your question, one of the things that I was hoping we would get to is an opportunity to make a pitch to a lot of the clinicians in this room, which is you are in many ways the most powerful voice for this to our external communities. So the other part of my job is in government affairs, and legislators can see a guy like me coming a mile away. I mean, I exude bureaucracy. But if you put a white coat or someone in scrubs in front of a legislative leader on a topic like this, it is amazing the transformation that can occur in their thinking about this. And as we think about sort of the concentric circles of change that we're trying to affect, from tote bags all the way to bending the curve so we stay below 2%, I think enabling our civic leaders, our state leaders, our national leaders to care about this is of the utmost importance. And one of the best angles that I've seen has been highlighting this as truly the greatest public health imperative that our society is facing today and has probably ever faced, and communicating that through the people that they're used to seeing when they go to their checkups or bring their children to the doctor, it's an extremely persuasive way of affecting change. And so as you think about what more can I do, track down the government affairs folks or your CEO and say, this is an issue that I care about. I do research in it. I do advocacy in it. Can you help me get in front of our elected officials to make this case? You're likely to get in front of them, and you're likely to make a big difference.
One thing that I was going to bring up is the issue of advocacy with patients. You know, I think a lot of us feel a little uncomfortable about bringing up political issues, and of course, climate change, it shouldn't be, but it is a politically charged issue.
Is it a political issue?
Oh, yes.
It shouldn't be.
You're right. But here in Boston, we have a lot of people who just come in and want to dump on Trump, and I'm okay with that, but I had one of my long-term, very cute little old lady patients in her 80s who I asked her, you know, how she was spending her time, and she said, well, I've really been enjoying watching that Fox News and talking about socialists. And I couldn't bite my tongue. I said, you know, I'm not a big fan of Fox News. She still comes to see me, but I felt a little uncomfortable bringing that up. And with regard to climate change, you know, you can present it as education and an important health issue, but how far do you go in advocating with patients, you know, especially when it starts getting into the political side of things?
I would love to.
Yeah.
Oh,
No, go ahead.
I'd love to offer a follow-up to that. One of the earlier presenters displayed the Yale School of Public Health, George Mason, Climate Change Communication Survey data on the 6 Americas, from alarmed and concerned all the way down to dismissive, a variety of categories, and noted that the alarmed and concerned have increased dramatically since 2014. So we're making progress in educating our patients, our communities, people around the country. It is becoming a far less political issue. There are conservatives around our country in the military. Those in the military realize how complex climate change is because of those who report to them and the areas in which they serve and the increase in heat and water insecurity. Conservatives who are our religious leaders are more and more engaging in this issue. So have faith, we're making progress.
Well, conservatives should be very concerned about climate. I mean, the history of conservatism has included, you know, protecting the environment in the past, and it's just, as far as I can tell, it's a relatively recent phenomenon that it's kind of lost its allure to them.
I think the advocacy challenge is walking a fine line between making sure the urgency is felt, but that it's not considered hopeless. And so I think that's why the storytelling, and I cannot underscore Bernie's point enough. They see me coming a mile away. They now run when they see me. But the notion that that there are things we can all do, and there are things that our organizations have done, and there are commitments we are prepared to make, is far more powerful than just, you know, we're all going to burn up. And I think that it's education, which is the most important thing, and then it's advocacy that is directed towards solutions. And I think that's what the really smart people in buildings like this all around our city can, and across the river in Cambridge, that's what we need to be working on, I think.
Well, one of the reasons to get everybody together, I think, is to really think about how you all work together, especially for challenges like climate adaptation. How do you keep the lights on? Kathleen, you mentioned that. But how do you work together as a group? One of the questions that I'm looking at was looking beyond facility planning. What can health systems do in redesigning clinical operations to meet climate crisis demands? What do you do for that type of planning? Does Boston have that type of planning among the hospitals? Can you describe how that happens and how that gets adapted over time to understand the challenges you're facing?
I think that's a really good question, whoever submitted it.
I know, it was much better than mine. That's why I'm using it.
No, but the, you know, yes, we have an answer. It's out of our emergency response system, which is citywide and statewide. But that's after an event has happened.
Yeah.
And I think what we don't have is enough planning on the prevention. I look to you, Bernie, or Nick, or Patrice. But I think we all know what we would do if Superstorm Sandy hit here,
Yeah.
but or a Katrina hit, or something else happened. But we have no longer-term plan for schools that are too hot, for kids who can't go to school, or we're no longer operating as the institutions we are. We're in some kind of emergency response
Well,
mode.
emergency is being redefined.
Right, but I think what it needs to
Yeah.
be is prevented.
Yeah, that's
And
Yeah.
I think there needs to be, everybody knows what to do if a disaster is declared. I think we haven't done enough work on preventing the disaster.
yeah.
Would you agree?
I would agree wholeheartedly.
Well, I think if you look at some of the disasters we've had here in Boston, the Marathon bombing and fires, there was the Station nightclub down in Providence where they had 100 people in the ED at once, and they did a great job. So I think we do a decent job when the disasters are at that scale. But if we encountered a disaster that was ramped up, a quantum greater, we would all be up the creek because we don't have that kind of excess capacity. I was in Utrecht in the Netherlands about a decade ago, and they showed me their Calamity Hospital. They had a 400-bed hospital just sitting there waiting for a disaster to happen. I don't know if they're still doing that, but we run very, we plan for, keeping our hospitals as full as we can, and we skim off excess capacity. That's what I've seen again and again. So we would easily be overwhelmed if there was a major environmental disaster.
I think there's also something underlying that question, which is about how within health systems, across health systems, and also across sectors, how we can better collaborate with one another. And this has been a particular interest of mine, both when I was in California and here, which is how do we, beyond having sponsors as a symposium, get these large, complex, well-resourced institutions to work together. And I think the thing we need to avoid is that the great health systems and universities that are listed on the sponsorship page, if their partnership on this issue stops at the end of the symposium. I mean, I'm hoping it's actually much more of a starting pistol, and Kate and I and others were talking about this earlier. If there's any issue that we all can rally around together, this is one great example of it, and the whole will be much greater than the sum of the parts if we address these issues, if we advocate not as the Brigham or as BMC or as Tufts or as IHG, but as a collective of health systems, universities, great civic institutions who together agree that this is a huge problem, and the great minds around it can help chart solutions to those problems.
Well, I think one of the questions that keeps coming up a little bit is basically one of the questions that Kathleen, I think you prompted it, is how do issues bubble up? Basically, people are asking how they can make a difference, because it's great to hear from people at the top, but how do you get from the middle from the bottom to the middle? How do you begin something like this? And frankly, from my perspective, it's hugely challenging if you're starting from zero to get something moving forward. And so I'm really interested in, do people become incredibly annoying? Do they be visionary and hand you a plan? What do they do to get moving from all the things we've talked about to building climate into how you do healthcare? Look at your clinical practice. What's the first thing that someone ought to do to make their voice raised after they leave today in your institution? Okay.
So I would start. So I would say call a meeting of like-minded individuals to start a conversation. So in a very fortuitous way, I was invited to grand rounds that the Department of Medicine put on at the Brigham on the topic of climate change and its relationship to health. And I just went as a happy audience member, and I wanted to learn. And it was amazing, the energy in the room, and I thought, well, this is my moment. And so I think I was the last person who asked a question. And I said, I'm not actually going to ask a question. I'm going to make a pitch. And I said, I'm new to this job. This is something I care about. How can I get involved? And Karen and others had already started something. So it wasn't that I initiated. I actually followed. I docked on, and there was a group of trainees and faculty who were thinking about ways to move this forward and were looking for a pathway to break through. And getting out of the way, we're also pathfinders, right? We can create the avenues to the facilities leadership or the resources. And so I would say start by getting people together who care about this, gain a collective voice, and then get a like-minded person from the administration or from your departmental leadership to fly it up the flagpole. Because I think to Kate's earlier point, no one dislikes hearing about this stuff. People want to hear about the things that people are inspired to talk about and want to move forward. And it's great. I mean, it's just the kinds of things that we should be doing to make us feel good about what we do every day.
I'd say credible champions, manageable bites, and actionable solutions. It's hard if you're a CEO of a big sprawling organization to add climate change, the movie, to your to-do list. But but changing a few things around in your operating room, or thinking about your building priorities, or aligning, I think the strategic part of this is aligning your sustainability aspirations with your growth agenda. That is really difficult. Everybody who comes into your office is looking for something else, whether it's a person, and that person, guess what, is going to need a parking space, or it's an office, or it's a lab bench, or it's a procedure room. That's the part that we need your help in breaking through on. And I know we can. I mean, we got part of the way there at BMC with what we call the integrated procedure platform, where IR, Neuro, IR, Cath, EP, and OR share everything. It's nothing short of a miracle. And I think that
Ari's agreeing with you.
Yeah, and I think that that kind of, but we were able to build it from scratch, and that's the kind of work that you guys need to help us lead.
Yeah, it's interesting that the bureaucrat wanted to start with a meeting, and the CEO wants actionable solutions. My experience with the American Thoracic Society, I would have probably appointed a task force. And I also think that...
And Patrice has a curriculum. We all play our roles.
We have a plan for that.
But you also find...
I got a regulation I could whack you. Used to, anyways.
We're like a terrible band of superheroes.
Really fun to hang around with, yeah.
But I was going to say, it's important to find champions for things, people who really are passionate and tap into that energy and give them, the mission. And yes, you need meetings and all that, but
And just from a groundswell perspective, we've been going to the various partners institutions as well as Spalding to present to the health professions. So among our presentations was one at Brigham and Women's Hospital. People sat on the floor, standing room only. They're anxious and so excited about the opportunity to bring their climate concerns to their workplace to better care for patients. The same at Mass General. There was a huge audience to learn more about it. We conducted a survey there, and 72% of clinical nurses wanted to know more about how climate impacts health systems, and they'd like a series of CE offerings on that. The same at Spalding. We were at McLean yesterday, so people at the point of care are really interested in this.
Your group brings a lot of life to everything that you do. I mean, it was really fun. Fun to hang out with, and I don't say that often in my life. One follow-up I wanted to make was just really a comment on what Kathleen said about making things actionable. And, this is a struggle for me with climate change and has been since we started dealing with it, because it's such a big issue. And people want a big answer, especially as scientists are telling us we've only got 10 years. You feel like you can't take 2 leaps forward. You got to go very near the finish line. And it's really stopped people in their tracks, because change doesn't happen that way. Change happens when they go with you with 5 good ideas and you actually say 4 of them might work. And then you'll get 25 of them. And then you'll pick 20 that are really good and you move forward. So I just wanted to say it to encourage people to do small things that visibly make a difference. That's what brings hope.
Right. I agree. I totally agree.
That's it. And it's just inspirational to see things move forward. And then all of a sudden, if people feel like you bought into that, they'll bring you bigger ideas that you can then sort of get your arms around. So I think one of the real challenges we've had is all of the sort of trajectory we've been looking for has been unrealistic and frankly counterproductive in many ways. Not that you don't want to know the timeline, but the way you work is to get out of the gate and run as fast as you can, and it takes time to build up that speed. And that's why it's, I'm looking at some of the questions here, and they're at very different levels. But one of them that I don't want to avoid is I probably should because it's controversial, but now that I'm an advocate at NRDC, I can bring this stuff up. I think one of the challenges I also see is when you talk about fighting climate change, it does seem like we're the bad guy, when frankly we're fighting dependence on fossil fuels. I mean, let's just face that fact, because it is a fact of how we make this transition. And not every hospital in Boston is positioning themselves to be looking away from fossil fuels. Is that a polite way to talk about this? And we really have to think about that. We are, the way the energy world works is we're not as constrained as we used to be about looking outside the box. So why aren't we? How do we start moving big change? And I love the idea of looking at renewables elsewhere and start purchasing those. Yeah. Those are important. If we don't start investing on the things we care about, we're not going to get there. Is there something we could do together to make sure that that's a more robust conversation instead of a done deal?
Yeah.
I know, I'm an advocate. It's so much fun. I'm out of the box.
Let me just take 1 second on this. So basically the question is, so BMC really cares about this, and you've made some progress, Kate. Why hasn't the BMC portfolio divested itself of fossil fuels?
That would be a good question, if you'd like to ask yourself that.
Well, I might as well just stick my head in the blender right now, but it's all right. I can't hear my answer.
I say it with love and affection.
Yeah, I can tell. But no, but it's a question I get a lot on campus, and I've thought about it a lot. And I think the first thing is that if you actually really dig at the fossil fuel question, it's in every part of our life. Yes. And so one of the things is it's a pretty catchy saying, and it's a little bit different than divesting from South Africa, which I think we grew up talking about. But that's the first point I would make. The second point I would make is at a place like BMC, we often are challenged to, I use the phrase, should we take our balance sheet out for a spin to see if we can have an impact on people's health, like more on housing, divest from fossil fuel. And our board's their message to me is, Kate, you have a pretty flawed economic model. We might want to hang on to this balance sheet so we can keep the business going longer. Yeah. And so that's another factor that, and the third is, it is in fact happening. And that there's a difference between, kind of the people who are cleaning up their act in the energy space, which you should support, which divestment doesn't let you do, those people who are moving towards the Paris Accords. I think there's a better approach than straight up divestment, but maybe that's just I've gotten old. But that's one of the things I spend a lot of time thinking about, because everybody talks about a fossil-free world, but no one can imagine living in it. And I think that's what we have to reconcile. So again, I've been on the I'm getting the hook now. I must really be in trouble. But I've been on the. That's why I'm on sort of the.
Is for me, not
oh, okay. That's why I'm on the actionable the actionable stuff, the actionable steps, not the broad sweeping steps, because I don't think they hold. But that's been my personal point of view.
Well, I mean, and Kathleen, it was not just directed at you, it's more at all of us, because there's not one of us that isn't reliant on fossil fuels, and there's not one of us that's looking to see what we can do in our own personal life and realize it's limited, just like you're limited in terms of your choices. And I think one of the sort of internal questions here was not so much directed at you, but politically, can you as a medical profession in medical care institutions speak with a louder voice in the political decisions that are keeping us dependent or preventing us from taking more creative approaches? So I don't think we can localize this issue at you or at what's going on at the Brigham or anything. We have to think really about how do our voices get raised in the city of Boston, so we are leading this charge as you go to the other 7 or 6 cities, and then how do we make our voices louder in the larger ether so we have more choices available to us to keep our community's health solid and make us safe.
And I think the only thing I would add to this is, I do a lot of advocacy work, and and I'm a registered lobbyist and all that stuff. I don't talk about climate enough. Yeah. When I'm in the State House, I'm probably talking about rate. I could be talking about housing. I could be talking about opioid use disorder. It's not top of mind. And I think for us, it's going to have to be that. And and so I think that a lot of, I think what your exhortation is really to sort of, if you have a legislative agenda, and every big organization represented here today has one, is climate. If it's not number 1 on the list, it should be in the top 3. And is it in all your talking points? Is it in all your town halls? Is it in everything you do? Because I think that creates the momentum that this problem, it's a big problem, and we're going to need it.
And I think one thing that Kate hasn't referenced but is really important is the Green Ribbon Commission in Boston and the great work that has been done there. And the question now becomes, and John Cleveland and I had a conversation about this just the other week, what's next? And that, I think, has to be our continual question about what's the next step that we're going to take to advance this, because that marries the actionable with the ambition. Because I think absent the ambition, it'll always be highly incremental, but absent the action, people throw up their hands. And so I think it's finding that sweet spot that exists between the two.
Well, I know that we're basically out of, no, we have 2 minutes left, so let me grab those. First of all, to thank you all, but also, to end on the conversation that we were just having, which is that there's much that we can do with our own voices in our own institutions and in our own lives. What we cannot allow other people to do is to tell us we can't do that or to limit the potential and the possibilities. I think I want to end where Kathleen began, was to say that she did this because of the cost issues. Hallelujah. There is nothing that we have talked about that wouldn't prevent people from being sick or weaken our ability to serve the public we're supposed to, that would cost more money. So don't ever think that this is an economic problem to actually address climate change. It is the biggest opportunity we have to do our work better, to be part of our own communities, to change our lives, and to protect our children's future. That's what this panel is all about. And we're all limited to what we can do, but we're not limited to our ability to speak out and to join in the ether out there that's demanding that we have more choices in fossil fuels. And if we're stuck, it's our voice that's going to have to get us out of this. So I want you all to thank the wonderful people sitting here.
And the moderator.
Who really
Thank you.
represent all that's best in Boston. Thank you very much.